So Pran, that was a really incredible talk. Thank you. So you may be aware that there's a condition called CKD-U, which is CKD of unknown origin. There's epidemic proportions in many agricultural communities in lower and middle income countries. So Sri Lanka has been one country. In South America, there's these other pockets. Within Australia, we've obviously got some geographical variation and some hotspots of kidney disease. And there's been some literature to suggest contamination of water as a cause. And I guess I'm just kind of interested in your perspective of agrochemicals and other diseases such as kidney disease, and then how do we mitigate that?
Thank you for the question. So just to give you some context, Clinically, I saw a wheat farmer about 2 months ago. At the age of 48, I think it was, he was diagnosed with prostate cancer and successfully beat that. He came to see me from the country and with a metastatic illness, sadly, where the cancer had spread all through the abdomen, and we discovered that he had a metastatic gastric cancer, stomach cancer, and he was in his mid-50s, and he said to me, why is it that I've had 2 cancers within this time frame? There's no such thing in my family. There's no real significant family history. We spoke then just to give him some closure on the potential triggers. And as a wheat farmer, I said, how much glyphosate are you using? And he said he's using it a lot. And they do wear protection whilst they use it, but sadly it's within the bloodstream within seconds of use. 90% of glyphosate is excreted through your urinary tract. So it comes into contact with the kidneys and the systems that plumb into it. 10% is excreted from the gut, which is where I was saying that the damage to the microbiome is coming from. The contamination of our drinking water is insidious and just fundamentally wrong. And it's not just glyphosate. There's many agrochemicals that leach into it. Sadly, part of it relates to the farming systems. As I said before, a lot of these soils, they just don't hold rainwater as well as they should. Hence, there's leaching into water systems, which we're then eventually consuming. So the solution goes back to my message again, that farming does need to change. I think it's at the heart of a lot of issues.
Firstly, thank you for 2 absolutely superb talks, and I'd like to thank Rod and the organisers because the quality of the talks this weekend have been consistently mind-blowing. First and foremost, just something that you alluded to, Peter, in your discussion was that tinnitus reduced in somebody who was getting their HbA1c under control. Is there a possible explanation for that?
Well, my overall sort of concept, I guess, is that a lot of these conditions are caused by inflammation, and I think there's pretty clear evidence that reducing carbohydrate intake, reducing sugar and seed oils can reduce inflammation. So that would be my best guess. As I think I've said at this meeting before, I often think, we should really talk about an anti-inflammatory diet rather than a low-carb diet. I think we'd probably get better traction in the community and the medical profession if we did. But I certainly regard, what we're doing as an anti-inflammatory diet. So I'm guessing that's probably the reason for a lot of those improvements.
Wonderful. Sorry, Doug. Just a very quick comment. I'm just about to revise a assignment I'm doing about type 2 diabetes in terms of primary, secondary and tertiary care. So I hope I pass because the guy who's marking it is Ansel Keys' #1 fan.
Two almost very brief questions. One for Pran, what do you do to avoid the toxins in your food and your water and to a lesser extent your air? And to Peter, are you going to expand the app for people without diabetes?
Look, I think part of the mechanism behind animal-sourced foods being, being protective. I mean, we see a lot of people go on these elimination diets where the focus of the diet's built around meat. And the important thing to understand is that it seems the glyphosate or Roundup and similar sort of products don't actually accumulate in the muscle tissue as such. So I suspect the toxin load from animal source foods is considerably lower. With regards to the pulses and the cereals and the grains, I think it just comes down to sourcing your foods from farmers that are trying to produce these sort of foodstuffs without these inputs. Very difficult to find, and it's all about kind of connecting back to your local communities, which of course in these gentrified concrete jungles that we live in is very difficult. So it really does require an effort to find that reconnection. With regards to water, that's a very, very difficult one. And I think as we showed, the bottled water is probably some of the highest stuff. So sourcing water from a source that hasn't been contaminated with glyphosate, it's a very, very difficult ask.
What about filters? Do you have a filter in your house water systems?
Yes, we do. We've got filter systems. I'm not sure that the filtration's effective for glyphosate, Peter. A lot of my water that I consume, and I don't want to come across as a wanker, but it's we've got enough wankers on the panel here.
I'm the comedian, not you. Come on.
The San Pellegrino waters from Italy are great, very high in mineral content. Obviously, the water systems there, flow through these natural aqueduct systems, and hence their richness in minerals. Additionally, it's quite interesting with regards to Italy. A lot of the farming techniques employed are still very much historical farming techniques in some of the regions. This is why a lot of people can go overseas to countries like Italy and consume the wheat without too many issues. There's a lot of anecdotal evidence of that. San Pellegrino is a pretty good brand to use.
Thank you very much both, and particularly to Pran for an inspiring talk. My comment is for Peter Brukner. There's a lot of quibbling about terminology. I see reversal as being a direction, and that if your HbA1c is going down, that's a good thing. But one of the quibbles that I find on social media is that people say, yeah, you've got remission, your HbA1c is 5.7, but you go back to your usual diet. The underlying pathophysiology is still there. How do we respond to those critics?
Yeah, I mean, it's interesting, isn't it? I mean, there are just some people who just don't want to believe that you can, and they tend to be, unfortunately, members of our profession, Liz, and I said to someone yesterday, I think the biggest impediment to good health in Australia is the medical profession, and it's it's a sad reflection, really. I'm embarrassed, really by many of my colleagues who just can't see who don't want to believe the facts. I guess the slide I put up about the reduction in complications of reducing your HbA1c by 1%, is an argument. I mean, I think whether or not you would go back to being diabetic if you went back on your old diet is pretty irrelevant, really. I think. I mean, the issue is you're currently in a non-diabetic state, and you've significantly reduced your risk of complication. So, I think that's the main argument for it. But I agree, it's frustrating, very annoying. And, you certainly can't help thinking that the endocrinologists have deliberately set the bar as high as they possibly can for remission, for their definition of remission, so that, the percentages won't be that impressive. Whereas really, as we know, the percentages of people who are significantly improved, whatever the definition is huge.
These questions for both Pran and Peter. Your first statement was all disease starts in the gut, which echoes the father of medicine, Hippocrates, who many of us have sworn an oath, the Hippocratic Oath. Why do you think doctors have lost their way, and what do you think the potential solutions may be?
Well, I mean, this almost falls into a philosophical or spiritual sense. I think science has become deeply rational, and it's become a method of governance, how we're controlled and governed fundamentally. And this is through methods of technocratic governance. It's, to me, it's actually a reflection of that type of society where Peter, who's come up with a brilliant innovation that should help people from a metabolic perspective, has to take it to government to get this across. To me, medicine lost soul. And that's what it comes down to. And that is reflective of a society that no longer believes in the concept of a soul. And when you lose soul, whether it's in farming or in agriculture or medicine, you become disconnected from the source that we've got to provide by. We lost our passion. And as a field, I'm deeply embarrassed, like Peter is, and deeply frustrated because I realise that we have selected for compliance rather than brilliance, and and those that try to innovate are very quickly removed, and this is this is one of the barriers. But I think the time has come to kind of push beyond that, but has to be done very carefully, cautiously, so that we can continue to keep delivering the message.
Yes, I mean, I think that the medical profession has been captured by Big Pharma, and the funny thing is they don't actually realise it, most of them, and most of our education comes through, is influenced by Big Pharma, either directly or indirectly by sponsoring education activities. I mean, they're very clever. You know, you've got to face it. I mean, they're brilliant, and what they do, and most doctors would deny vehemently that they're influenced by Big Pharma, but they all are, and. It's also, you know, you tend to stay in your comfort zone, you know, and for doctors, our comfort zone is drugs and surgery. That's what we're good at. That's what we're taught. You know, I mean, we're not taught anything about nutrition or exercise. I didn't have a single lecture on nutrition in my 6 years of medicine. Now, that was a long time ago, as you would realise, but, you know, I don't think things have changed very much. And I know we have a couple of people in the audience from Deakin who are very frustrated and they can't get nutrition and exercise and lifestyle issues onto the medical curriculum still, despite all the evidence. But keep trying, guys. But yeah, exactly. Well, that's true. And Ron's had the experience of being kicked out of the university lecture circuit because you know, he wanted to talk about low carb and so on. So you know, so doctors stay in their comfort zone. You know, they don't know anything about nutrition and exercise, so they just push it aside and send it off to the dietitians, or, you know, who are very helpful. And so you know, you stay in your comfort zone. So it's a massive issue, and that's why it's so hard to combat and so frustrating that you know, we just are making very slow progress. You know, every now and then we have a win with some, you know, medical specialists coming on board. And my big hope is that younger doctors in particular are much more favourable towards nutrition and lifestyle issues than the older ones. Many of them have adopted those lifestyle habits themselves and are imparting it on their patients. But they're too scared to speak out publicly because the senior people in the profession would slam them. And you know, after all, we've all got to have a job and put food on the table and so on. So it's a very difficult situation. But you know, this sounds terrible, but you know, you've almost got to. We're always going to have to wait for this generation of leaders in medicine to die out before there's any hope of change, because they're not going to change. You know, there's so much evidence now, and they're rejecting that change, and that's so frustrating. But anyway, I've said enough.
I just to finish on that, I think the generation of we've always selected for compliance. I think it is really important that the children that we're raising do have a significant mistrust in the system, and we have to breed into them an element of non-compliance. I mean, you can comply in a utopia, you certainly cannot comply in a dystopia. As my kids proved out the back there. I think all three have been kicked out by Rod for being disruptive, so I apologise for the...
Pam, thank you. I was a little disappointed in your throwaway comment about probiotics. At risk of, what's the take-home message? Are there some that are better than others, or are they all just expensive and useless? And should one think of them after perhaps a course of antibiotics?
The original probiotic is mother's milk, okay? Breast milk teems with fungi and bacteria. The baby is born with a neutral stomach without very little, with very little acidity, so that the microbiome can seed the gut, and it's done so within first few hours of birth, not just through milk but through contact with skin. The issue with a lot of probiotics, and the vast majority of them are relatively useless in my belief, is they simply do not survive the gastrointestinal tract to seed where they need to get to, which is primarily the hind gut or the colon. They simply do not survive the journey. This is why fecal transplantation has been a much more effective way of providing healthy bacterial species to the gut. However, I think with innovation, hopefully we're able to develop novel ways of delivering it to the colon, and certainly some of the spore-based probiotics have shown some promise. So let's see what comes out of it. I think my message is, rather than consume probiotic bacteria, how about we eliminate some of the toxins and the natural antibiotics such as glyphosate from our food supply, which is the major reason for dysbiosis, and be very cautious and judicious with antibiotic use in our children. No one can argue the brilliance and the life-saving capacity of antibiotics, but we've overused it. Most kids by the age of 5 years of age have probably had multiple rounds of antibiotics, and this is the fundamental issue.
A question for Pran. Pran, as a GP, I get sometimes patients coming and asking about GI mapping for gut microbiome, and I don't really know much about it. And so is there a place for that in GP land?
I don't think so. I think the vast majority of the population would show the usual overgrowth of the gram-negatives and a reduction in all the useful species like lactobacillus and bifidobacteria. I think we just have to take it back to core principles. If someone's feeling unwell within the gut and that drives them to do the GI mapping, chances are they're going to have dysbiosis of the gut bacteria. And then the integrative practices and in integrative medicine, some of the issues that I see is that we then push out a lot of these supplements and probiotics. That's a problem in itself, and that in itself becomes an industrial complex. So we've got to be super cautious about that. I don't know their role. I mean, when you look out into the universe, you see this vastness, and we can't comprehend most of it, and that's very similar to the gut microbiome. We see the vastness, but we don't know what it all means.
First is a comment to Peter. Peter, certainly hope the study goes well. I think that every person in Australia with type 2 needs help, and the app looks like it can be incredibly helpful. Thank you. Pran, the photo of industrialization and desolation of that monoculture, I see that is happening in our gut. We are actually creating a monoculture in here as well, and that scares the hell out of me. The question I have is, you mentioned leaky gut, and a lot of our peers would scoff at that. Certainly I feel it is there. What can we do about leaky guts, apart from trying to look at bowel flora? Are there things that can help?
Yeah, thanks, David. Look, leaky gut is driven by many things. For instance, long-distance runners or endurance athletes often suffer leaky gut, and that's a common problem and very well established. And the leaky gut is an insidious problem which opens up your gut to the external environment. One of the biggest drivers of leaky gut is dysbiosis driven by nutrition. right, through these monocrop practices and the agrochemicals, but also there's other elements to it. And it is thought that even stress, psychological stress, plays a huge role in leaky gut. Sleep deprivation plays a massive role in leaky gut. So it's really about addressing the pillars of health, which is physical health, which is underpinned by good quality exercise that doesn't put that strain on the gut. I think endurance sport is fine, but it just needs to be kind of balanced out with other things. I think athletes sacrifice their body to achieve the pinnacles that they achieve. Peter could probably speak more on that, but it's about finding the pillars in health, which is nutrition, sleep, emotional, physical, spiritual, all those things, and to be deeply connected with nature.
Excellent talks, Pran. Excellent talks, Peter and Pran. But just a comment, as a renal physician, not uncommonly I receive referrals for patients with albuminuria, with normal kidney function, with their A1C anywhere between like 5.6 to 6.4, which is below the cutoff of formal diagnosis of diabetes. And it's well known the microvascular complication of diabetes like retinopathy, neuropathy, and nephropathy starts at a cutoff of A1C 5.5, not 6.5. So patients can end up with microvascular damage and complication before they are formally declared as diabetes. So I think our bar for declaring diabetes or goal should be even lower to achieve an optimum health.
Yes, I agree. I think absolutely the evidence shows that anything above an HbA1c of 5.5, you start getting some complications, and that's generally defined these days as pre-diabetes. But I think there's a good argument for lowering the threshold to 5.5 or 5.8 or something like that. There was a paper that came out I think earlier this year promoting that concept, and it's funny, they're constantly trying to sort of lower the cholesterol threshold, aren't they, to get more people on statins, but they don't seem interested in lowering the HbA1c, where there's actually far more evidence to support than the cholesterol. But we won't go down that rabbit hole for the moment.
Hi, this is a question for Pran. We've experienced a lot of long COVID patients coming into our hospital, and they've got associated conditions like POTS and Ehlers-Danlos syndrome, and they experience major gastroparesis and difficulty eating, lots of young teenage girls. And we've had to put them on NJ feeds and TPN. I don't know whether you've experienced any of these patients coming into your practice and what you have done with their treatment plans.
Yeah, this is an excellent question. It's something that I've actually pondered, for a while, and unfortunately I don't have a straightforward answer for you. Ehlers-Danlos is poorly recognised, and a lot of these young women as labelled as having psychiatric illness, although it is very real to them. It is a syndrome that is deeply associated with gastrointestinal illnesses, mast cell disorders, autoimmune illnesses as well. It's a complex that I'm struggling to understand. For some reason, these people obviously are genetically predisposed, but I suspect it's an epigenetic phenomena where the environment is awakening these dormant genes, and why that's occurring, well, it again speaks to a broken environment. The gastroparesis that they suffer is extremely debilitating. And, the medications like Maxilon or Domiperidone, which are the prokinetic agents, do not work very well. So I don't have a solution for this, but I think, again, we must go back to first principles and say, what is the potential triggers that are driving it? It certainly wasn't recognised even a couple of decades ago, and I'm sure these people existed, but the rising incidence is a trajectory that we cannot ignore, and I suspect it's epigenetic rather than genetic. It's the environment speaking to DNA.
So this will be the last question, and then we're going to wrap it up after this one.
It's not so much a question, it's rather a comment to the microbiome and microbiome testing. So I'm a functional medicine practitioner, and the mantra is in functional medicine all the time, all disease starts in the gut. And you said, well, gut microbiome testing doesn't really have much of a place, and I do tons of microbiome testing. Of course, I mean, I fix a lot of things by, just getting the sugar and the fructose out of someone's life because that's what feeds the bad bacteria, the bacteria that actually cause a lot of acidity and hence leaky gut with all the things you mentioned, Pram. But I have lots of patients as well that do have watched every low carb Down Under video already and they're on low carb, so I don't have to brainwash them again. It's beautiful. But they still have symptoms, and it's not just the gut symptoms. They still can't get rid of the skin diseases or this sort of asthma-like or histamine-like or allergy-like symptoms or the brain fog or whatever it is. And I find lots of time when I actually look at the gut and see what's happening, what's actually going on in there. And I always do live cultures. I never do DNA testing. And we can fix so many things by just knowing what's actually going on there, even though they do the right thing already. But whatever happened in their life before, and as you said, it's what we put into our mouth. How are we born? How much dirt have we been exposed to? How much stress would we have in life? There's so many factors that actually influence what the gut microbiome is developing to. And until I really know what's actually going on, then we can basically make a lot of people much more happier by just addressing the gut with the help of gut microbiome mapping. Just a comment.
That wraps up this morning's session. You're released, gentlemen.